This is where we ended up last time. We're talking about immunity. Immunity is really important. It keeps you from dying. It keeps you from dying like your third day of life. You've got neutrophils that fight off bacteria, and there's bacteria just all over the place. A lot of pathogens. There's a lot of bacteria out there that are good bacteria that you don't want to kill, but of course your body needs to decide whether it's a good one or a bad one, and that's its job. Strep would kill you, staph would kill you, gonorrhea would kill you. I mean, just syphilis would kill you. All of these things, if we didn't have natural immunity against them, they would kill us. But most of the big killers are actually viruses, and viruses are combated by these cells right here. These are lymphocytes. These over here are the neutrophils, and these are the lymphocytes up here on the top. Lots of viruses, things that wiped out most of the indigenous peoples of the Americas were viruses. Smallpox is a virus. Hepatitis is a virus. Measles is a virus. All of these are viruses, and the lymphocytes fight that off. So if you have a viral attack of one kind or another, influenza, of course, is a virus. Herpes is a virus. Ebola is a virus. The hantavirus is, of course, a virus, which was in this area. The first time I ever came to this area, the hantavirus was here. And it was killing young adults and teenagers. The strongest people on the reservation were dying of this stuff. Of course, it didn't kill very many people. It's a virus that's carried by the deer mouse. Anyway, eventually we figured that out. Fills your lungs up with fluid and you die. But there are other things out there that can kill you if you have a parasite, or if there is an allergen in the air that irritates you. You'll get an excess amount of eosinophils. And eosinophils, of course, are these two. This one's an eosinophil. Those are eosinophils. The heavy metals are phagocytized. They're engulfed by basophils, and these are basophils over here. And then the last one is cancers. Of course, we have cancers trying to wander through our body all the time. The younger you are, of course, the easier it is for you to fight off a cancer. As you get older, when you are in your middle years, you're a middle-aged individual, you can fight off cancers. As you get older, of course, your immune system decreases, and you can't fight them off as well. The immune system is very adaptive and maintains itself through several structures. The B lymphocytes comprise the humoral immune system. These cells are produced in the long bones. Very important. So if you have leukemia, it usually has to do, it always has to do with the fact that your long bones are no longer producing white cells, or they're producing them at an excess rate, and it is known as leukemia. Leuk meaning white, so it's white cell cancer is what it is. So that problem is you have too many lymphocytes in your system. The B cells produce antibodies or immunoglobulins. They either directly neutralize the antigens or foreign body or enhance the destruction of other cells. This works very well, of course. So it's mostly your lymphocytes that are destroying the new things coming in. We'll talk about what type of cells are the B cells. Oh, don't do that. Come on. Okay. Why did we do this? I don't know. Wait a second. Let's try this. Oh, there it goes. Let's go to the next one. Okay. I need that to go away. I can't get rid of that. Okay. Cell-mediated immunity involves lymphocytes formed or converted in the thymus behind the heart. So you have lymphocytes coming from your long bones, you have lymphocytes coming from your thymus. There are three kinds of T cells, thymus cells. The T helper cells that produce interleukin and lymphokines. The T helper cells, this is what we count when we are looking at somebody with HIV. HIV, of course, the T helper cell is infected by the HIV virus, changes its DNA, and since it changes its DNA, it makes it non-functional. So what we do if we're looking at somebody with HIV, we can tell how far along they are in their disease by counting the number of T helper cells they have in their system. The more T helper cells they have in their system, the more interleukin and lymphokine that they have. The more interleukin and lymphokine they have, the less destruction the HIV virus can do. Another T cell is the T killer cells. These wander around the body, and they are the ones that attack. When another cell, when the T helper cell puts an antigen on an antibody on the antigen of a disease, like a virus. Come on. The new one's gone, and I don't know what Marius did with it. We'll pretend Marius did something with it. Come on. Anyway, so when the T helper cells puts an antibody on an antigen, the T killer cell comes and kills the whatever the virus is. Come on. It worked right away. I don't understand. I don't understand. Let's try it again. There we go. Let's try it. No, yes. Come on, pick it up. Shoot. There it goes. Kinda. We'll pretend it's okay. And the third type is a T suppressor cell, which suppresses humoral reactions. This is important because an excess reaction will cause an autoimmune disease. So the T suppressor cell is pretty important. All right. Come on. I was thinking about this. There we go. We need a new one of these things. There we go. All right. Besides B and T cells, a major leukocyte in circulation is a cell that does not require an antigen to trigger the immune response, and this is known as a natural killer cell, or NK cell. It's a free-floating granular lymphocyte that recognizes stressed or alien cells and destroys them without an antigen-antibody connection. This is important. This is the one that kills your cancers, potentially. This cell is produced in the sides of the thymus or the bone marrow, also the spleen and the tonsils. Now this can be a problem for somebody who doesn't have a spleen, like I don't. Or somebody who doesn't have tonsils, like I don't. This could be a problem, or maybe it's not a problem. Then the NK cells are produced and they're just free floating. So not only do I have NK cells that are free floating, well, as we're going to find out, the spleen is really kind of an important organ. Well, most of the leukocytes circulating in the body are granulocytes. Various organs will act as staging areas or modification areas in case of viral invasion. And this is what your tonsils are for. The reason you have tonsils when you're born is because it's right there with your respiratory system, right on top of your respiratory system. And it's there in case you come in contact with a common cold or any kind of rhinitis. After you go through puberty, you probably don't need your tonsils anymore, and for that reason, a lot of people have problems with their tonsils. For the longest time, that was something that everybody did. They had their adenoids and their tonsils taken out at some juncture during their childhood. They don't do it so much anymore, unless the individual is suffering from chronic tonsillitis. The spleen is a major staging and modification organ in the body, and that's the reason the spleen is there. The spleen doesn't actually do a whole lot. Well, it sounds like it does a whole lot, doesn't it? Yeah, it's really important as far as your immune system is concerned. It's also a repository for red blood cells. So when you get into a situation where you need more red blood cells, your spleen has an excess amount of it. But it also acts as a staging area for your. It doesn't really produce anything. It's like a repository. It holds things. It's about the size. It's about the size of your fist, and it's attached to the rest of the body by a stalk, by a single stalk.
Like broccoli, right?
I'm sorry?
Like a broccoli?
No, that's not that thick. The stalk isn't that thick. The stalk is relatively narrow. It's a blood vessel coming in and a blood vessel going out, and that's it. That's all there is to it. So it's not being held on by very much, and that's why if you rupture your spleen, well, you've got those two blood vessels. So if you rupture your spleen, you've got those two blood vessels leaking blood into your thorax for one thing. But you also have an excess amount of blood in your spleen itself. When I ruptured my spleen, I was during a soccer game, and I was already using the red blood cells out of my spleen. And when he hit me in the chest, it just knocked it off, and he busted it. I mean, he busted it as if it were a water balloon or a piñata or something. And so when they went in there, of course they didn't go in until 28 hours later, but when they went in there, he said it looked like a hand grenade had gone off in my thorax. I had blood, and I had blood clots, and I had pieces of spleen just all over the place. So instead of just making, and actually they made a small incision right here, but he said he found the damage so extensive that he had to cut me from here to here in order to find everything, digging around in my gut. And he didn't take my appendix out. But I was on the operating, well, he killed me twice. He killed me twice. The first time he killed me was when he pulled out a clot. He pulled out a blood clot, and it was a clot that was right over the two major blood vessels. And when he did that, I started bleeding, and of course I went into shock. I died. And then the second time he was cleaning me out, and well, he's still pulling stuff out of there. And the second time, I just went into shock. He said he thought it was because I was short, I was low on blood, and so they gave me six units of blood. Anyway, it didn't kill me. obviously it didn't clean. The spleen normally contains 40% of the NK cells, 25% of the B cells, and 10% of the T cells. Since I don't have this repository, where are all of my NK cells, my B cells, and my T cells? And the answer is they're circulating. I don't have a repository. I don't have a special place. So usually when a disease state starts, your spleen will be activated and it will release all these cells. But since I already have them wandering around my system, that may be one of the reasons why I so very rarely get sick. 40% of the T cells and 40% of the B cells are located in the lymph nodes for rapid modification. The lungs are a major staging area for lymphocytes holding 35% of the NK cells and 10% of the T cells, possibly to combat the respiratory viruses, which there are a relatively large number of. This can be a problem if the lady has, as you can see, this is a female, and there's a major repository or disposition of lymph nodes right under your armpit, right behind your breast. Normally, if the individual is suffering from some kind of breast cancer, the lymph nodes will be affected, so they have to take all these lymph nodes out, and that can be a problem. It hurts circulation. It can disturb her circulation. So,
excuse me. A couple of years back, my grandmother, she was walking back, and she's the type that will pick up stuff on the way back home. She said we didn't know she had the breast cancer.
oh,
And we're asking how did and it formed so fast without us even knowing. And she kind of retracted back. There's just one day I picked up a weight. Now, why did you pick up a weight, Grandma? And she said, I thought maybe you could use it around the house. She put the weight under here, under her arm. She carried it back like that. And that's just how it formed. And on my mom's side of the family, breast cancer come. So when there's a thing that she should just.
so this was your father's mother.
My mom's mom.
It was your mom's mom.
Yeah.
Okay.
That would be my son.
Okay.
Dad's that we know. And that's what took her out. The
Breast cancer?
Yeah.
What she did was, when she squeezed that weight against her in her armpit, as you can see, you've got all these lymph all this circulation. She cut off her circulation. Is what she did, and that potentially caused her problem. During times of stress, the immune system is suppressed. While on the surface this may not make sense, one must remember that the immune system marshals a great deal of resources. So you need to stay healthy. If you can stay healthy, your immune system will be strong. If you can stay away from stress, your immune system will be strong. When in a flee, fight, or die situation, death will occur if the organism does not marshal all of its resources to survive the encounter, thus the suppressed immunity that we encounter. People under a great deal of stress over a long period of time are more susceptible to select infections. They're more susceptible to fatigue, of course, muscle wasting diseases, hypertension, ulcers, loss of libido, suppression of ovulation or impotence, accelerated aging is another problem with excessive stress. Psychology and medicine have melded at various times since the advent of psychology. Medical doctors are very aware that some people may think that they are sick but actually aren't. This problem is known as psychosomatic condition, and the medicine dealing with it is referred to as psychosomatic medicine. Health psychology is the field of how psychology may influence good health. Psychoneuroimmunology studies the immune system and its interaction with the nervous system and human behavior. So yesterday, I started out at 3 feet above sea level. I flew into Phoenix, which is about 350, I think, feet above sea level. I drove through Globe and then into Shola on that strange mountain. That's a pretty windy road. I went through Snowflake at about 5,000 feet, and now I'm at 75,000 feet. So I'm feeling the effects of going from 0 to 75,000 feet. If I'd gone to Albuquerque, if I'd flown out of Albuquerque, it would have been easier. Phoenix is tough. Phoenix is just tough. It's hard to get to from here. You have to go through the mountains to get there, unless you go the interstate.
You took the interstate.
I should have taken the interstate last night.
The day before, I believe it was the day before Thanksgiving, I went out and went to my a local in here.
Mm-hmm.
Some grandmas out there, and they needed some wood chopped. So I went up there, and when I looked up to the sky when I was resting, you can see all these plane trails all over the sky. It was all over. It was like early in the morning.
Yeah.
Around about 9. It's crazy. So it looked like a freeway up in the sky. A crazy freeway.
Yeah. Well, you're seeing all the flights coming out of Santa Fe, out of Albuquerque, out of Phoenix, Flagstaff, potentially Denver if they're headed in this direction. Chapter 16, Psychopathology, Biological Basis of Behavior Disorders. Probably the last one we'll get to, I'm guessing. According to a study by the National Institute of Mental Health in 2005, 32.2% of the population in the United States will have a psychiatric disorder sometime in their lives. About 1 out of every 3 people in the United States. Luckily, there's only 2 of us, so we're okay. It's the third person that has the mental illness. Within any given 6-month period, 19.1% of the population suffers from a psychiatric disorder, or 1 out of every 5. 16.4% of the U.S. population will suffer from some form of substance abuse in their lives. 6% have suffered some form of substance abuse within any 6-month period. 13.3% of the population will suffer alcohol abuse or dependence in their lives. 4.7% have suffered alcohol abuse or dependence within any 6-month period. Substance abuse. So it's about 1 out of every 6 will have a problem. 5.9% of the U.S. population will suffer from drug abuse or dependence in their lives. 2% have suffered some form of drug abuse or dependence within a 6-month period. And of course that's going up because of the opioid crisis in the United States. 1.5% of the U.S. population will suffer from schizophrenia in their lives. 0.9% have suffered some form of schizophrenia within any 6-month period. 8.3% of the U.S. population will suffer from an affective disorder, manic or depressive episodes in their lives. 5.8% have suffered some form of affective disorder within any 6-month period. This is the bipolar disorder. So you get 1.5% of the population suffering from schizophrenia. You have 8.3% suffering from potentially being diagnosed with bipolar disorder. 0.8% of the U.S. population will suffer from a manic episode in their lives. 0.5% has suffered from a form of manic episode within any 6-month period. 5.8% of the U.S. population will suffer from a major depressive episode in their lives. 3.0% have suffered from some form of major depressive episode within any 6-month period. 33% of the U.S. population will suffer from minor depression in their lives. An undisclosed number will suffer some form of minor depression within any 6-month period. 14.8% of the U.S. population will suffer from an anxiety disorder in their lives. 8.9% have suffered some form of anxiety disorder within any 6-month period. 12.5% of the U.S. population will suffer from phobia in their lives. 7.7% have suffered some form of phobia within any 6-month period. 12.5%. Usually it's snakes, spiders and snakes. 1.8% of the U.S. population will suffer from a panic disorder in their lives. 0.8% suffer some form of panic disorder within any 6-month period. 2.5% of the U.S. population will suffer from obsessive-compulsive disorder in their lives. 1.5% have suffered some form of obsessive-compulsive disorder within any 6-month period. As you can see, all these statistics are really kind of amazing. A study by Kessler and his colleagues in 1994 disclosed that almost half the population would suffer from a psychiatric disorder in their lifetime. So we talked about a third and a third again having depression. So it works out to about half of the population. 30% of his respondents reported a psychiatric disorder within the previous 12 months of the survey. And of course you have to ask yourself, where in the world are you doing this survey? Man, it sounds to me like that's a really crazy place. Is it New York City? Is it Boston? Is it Chicago? Is it Saley? Is it Chinle? Probably not Saley or Chinle. Probably one of the major cities. I'll have to admit that, where was I? I was in Fort Myers, Florida. A lot of people, a lot of really unhappy people. You can tell just by looking at it. Of course, it was Thanksgiving. Some of them were really old. Some of them looked like they were dying. I'll tell you what. Where was I? I was at a Publix. It's a grocery store, and there were more of those riding carts.
Yeah.
Oh man, I tell you what. And those people don't. They just zip from one place to the next. It was funny. And sometimes they were with other people who were pushing their cart or whatever. It was really kind of interesting trying to get around these people. Anyway, very old, a lot of infirm people down in Florida. 1900, at the turn of the 20th century, 20 to 25% of all the inhabitants of mental hospitals around the world suffered from delusions, grandiosity, and euphoria, poor judgment, impulsive and capricious behavior, and profound changes in thought structure. In 1911, this problem was identified as syphilis. They had syphilis. We couldn't treat syphilis yet. So if somebody contracted syphilis, it was a lifetime disorder, and eventually they would end up in a mental hospital. And that was in 1911. Since the development of antibiotics, the number of people suffering from paresis, and that's what they called this problem, paresis, has been reduced to zero. The reason I put all these up here is because this is what, if you have beta strep group A, this is what it looks like. If you have Staphylococcus aureus, this is what it looks like. If you have E. coli, this is what it looks like. But if you have syphilis, this is what it looks like. And this is what it looks like. It's what they call a spirochete. It's a spiral-shaped, corkscrew-shaped bacteria. Almost all the bacteria that we know looks like this. But here's one that looks like this. Now we find this out in nature, but not syphilis, of course. We find spirochetes out in nature. So these things very rarely infect humans. But here we have a spirochete that has not only infected humans, but has given us syphilis. As interesting as that is. And the only reason I show you this is because this is what I did when I was in the service.
Yeah.
I was looking for these guys.
Okay.
Yeah. Normally this is what you see.
Yeah.
Almost always this is what you see. Every once in a while you'll see these guys, but you never see this guy.
Yeah.
Ever.
Yeah, I didn't see that until you pointed it out at the bottom.
Yeah. Spirochetes. Those are known as spirochetes. And we hardly ever saw syphilis. There was a baby born with syphilis. We had to check everybody. I mean, we were checking people every year. They'd have a physical, and one of the tests was a test for syphilis. We rarely found any positives. Normally they check these guys coming back from Vietnam. I'll tell you what, Vietnam wasn't the worst. It was the Philippines were the worst. That's where we were finding syphilis. We're having an outbreak of syphilis right now in Alabama, Mississippi, Georgia, Louisiana. So if some lady from Alabama, New Mexico, not New Mexico, so Alabama, Mississippi, Louisiana offers to have sex with you, I would decline if I were you. Most psychologists consider, and I understand there's an outbreak in New Mexico as well, mostly around Albuquerque. Most psychologists consider schizophrenia the most serious of the mental disorders. Schizophrenia is known in every culture around the world. 1 to 2% of any population will suffer from symptoms of schizophrenia. And as I told you before, I have two nieces, a niece and a grandniece, that have been diagnosed with schizophrenia. While the description of the symptoms of schizophrenia has changed over the years, the symptoms themselves have remained basically the same. The positive symptoms, hallucinations, delusions, excited motor behavior, these are the things that are added to your personality, hallucinations, delusions, and excited motor behavior, or the things that are taken away from your personality. Slow and impoverished thought and speech, emotional and social withdrawal, blunted facial expressions. Now the problem is, once you get a negative symptom, it doesn't go away. The positive symptoms will go away. This is something that's been added, and those go away. These never go away.
That's what I've noticed, those symptoms. One of my siblings, when we first, the appearance of schizophrenia, but the positive system was really what we could see.
Right.
And then the negative systems is what you can slowly detect. Right. And it never goes away. Just remains there.
I think you've got a sister with the same thing.
That one's totally different. That one's like,
I think she's a paranoid schizophrenic.
It could be. She has some troubles all in the past. It's even though she does it to other people's pets, her own, she adores it.
That's not crazy at all.
She even has a baby carriage for her pets. She carries a license so she can carry the pets into buildings.
They were talking about that at the airport in Fort Myers yesterday. It's like every third person has a service dog. Really? This is for my emotional support. Okay. But they said the only service dogs that you could have that were allowed out were service dogs that were for sight. Mm-hmm. So if they were, because you were blind, the rest of them, all this other stuff, they had to be in carriers, or they wouldn't allow them out. I guess they've had a really serious problem. And I'm getting on the plane, and I'm at the back of the line. I always get on the lines. Yeah. And I'm at the back of the line, and like every other person's got a dog carrier or a cat carrier. Oh my goodness gracious, it was insane. Never seen so many pets in my life. And they got the little vest on that says,
yeah.
Okay. If schizophrenia is genetic, then relatives of schizophrenics should have a higher incidence of schizophrenia than the public at large. While the general population has a 1 to 2% incidence rate, parents have an incidence rate of 6%, siblings 9%, and half-siblings 6%. The closer the relation, the greater the risk. As I said, the schizophrenia is not on my side of the family. It's in my brother's wife's side of the family. And that's why she has, that's why my nieces have schizophrenia. Let's see if this works. Come on. Oh, I can't do it on this one either. I won't show it on this one either. Forget it. Come on. It's not going to work. I know it's not going to work. Marius stole the good projector. I don't know where the other projector is. He's the last one I know that has used it. Oh good, it's all tied up. Come on. What am I gonna have to do? Turn you on and turn you back off again? Reboot you? Oh, this is a pain in the butt. This could last all week. Okay. Let's try it again.
Okay.
Sorry about that. Yeah, like I said, it's on my sister-in-law's side of the family. Doesn't mean that people on my side of the family are the sanest people in the world.
I think on my side of the family, my dad's, they have some mental issues on their side of the family. But then, of course, Kat didn't really reveal her side of the family.
Ah.
She has a stepdad. All I know is that side. Afterwards, it's her biological dad.
Oh.
So she's telling me they have mental illness on that side. We went into for genetic testing a while back.
Is that good?
It was, yeah. It was the results after the miscarriage she had.
Oh, okay.
So they were telling us about the cells and the abnormals and XYs, trisomy 21.
Oh, trisomy 21?
Yeah.
Okay.
And
That's Down syndrome.
yeah. And they were telling us the miscarriage is falling into that category. It's abnormal.
Okay. They've done family studies looking at schizophrenics, comparing monozygotic and dizygotic twins. Monozygotic twins had an amazing 48% incidence rate, while dizygotic twins had a 17% incidence rate. So evidently it has something to do with gestation while they're in the womb. Children of schizophrenics have a 13% incidence rate. So my great-great-nephew has a 13% chance of being crazy, just like his mother. Work by E. Fuller Torrey has shown that when one twin is different, it is observable early in life. Research by Torrey looked at discordant monozygotic twins, shows that the twin that develops the schizophrenia is the lowest birth weight and the one who is most abnormal throughout life. The amazing thing about schizophrenics, if you look at home movies of schizophrenics, these are the individuals that don't want to have their picture taken. If you're filming a group and they're in a group, they'll be at the back. They won't have a smile on their face. My niece and my son were about the same age. My niece was born in December. My son was born in January, so they're almost the same age. So they used to hang out together a lot. But when they had their picture taken together, he was always smiling and she never was. When she was a baby, she always had that look like something's happening that she doesn't like.
Yeah.
I mean, it was just the most bizarre thing in the world. You know, you couldn't take a picture of her where she was happy.
Yeah.
It was just the oddest thing in the world. Of course, my son is a pretty happy guy. Of course, he's 46 now, so. And he's a math major. I don't know if that's a good thing or a bad thing. Elaine Walker looked at monozygotic twins in a similar manner. Walker proved that even the least indoctrinated layperson could pick out the future schizophrenic twin from home movies. So everybody knew which one was having problems. This they were able to do with uncanny accuracy, so you could tell the one with abnormalities, just like you can with my niece. So if you look at all the pictures we have of my niece, no smile, ever, hardly ever. Work by Levy et al. In 1993 and Stuvey et al. In 1997 demonstrated that individuals suffering from schizophrenia are unable to follow a slow to and fro movement as the pendulum, such as a pendulum of a clock. Schizophrenics tend to have their eye movements interrupted with jerky eye movements, so called saccades. So this is one of the ways that you can diagnose schizophrenia. This is the way a normal eye movement is. And this is the way schizophrenics see it. You can also treat PTSD with this type of eye movement. You tell the individual, don't move your head, and then you swing something back and forth. And force them to watch, not force them, but tell them to watch it. Of course, if they're schizophrenic, they can't do it. But if they have PTSD and they're forcing the eyes move up and down very easily, but they don't move side to side very easily. Okay. So what's happening here is they've got all these intrusive thoughts, but if you do this like 2 or 3 times a day for about 10 minutes, it forces them to. It forces their eyes into an uncomfortable position, is what it does, and they won't have those intrusive thoughts anymore, those horrible dreams and whatnot. Work by Kenny and her colleagues in 1975 and again in 1994 looked at the psychiatric histories of adoptees and their biological and adoptive parents. Kenny discovered that of the adoptees who suffered from schizophrenia, the biological parents were far more likely to suffer from schizophrenia than the adoptive parents. So it is nurture, not nature. It's nature, not nurture. I'm sorry. It's genetics that is more important. As we said with the schizophrenic twin, the probability is very, very high. If one of them is schizophrenic, that the other will be schizophrenic as well. It's that environment that has caused this individual to be schizophrenic. Combining the twin, the families, and the adoptee studies, many researchers have concluded that there is a genetic factor in schizophrenia that is inheritable. What structure is being inherited, what structures are involved, which genes are being inherited, and what processes do they control? That's the question that we have to ask ourselves. While autopsies often found enlarged ventricles in people suffering from schizophrenia, it wasn't until the brain imaging techniques of CAT scans and MRIs that this was confirmed in living patients at all stages of the disease. So the brain seems to be hollowing itself out from the inside out. The brain's structure is about the same size, but the holes in the inside are getting bigger and bigger and bigger with the schizophrenics. There's always a question if an effect is caused by the disease or the effects of the disease. Is it because of they're not eating properly, they're not eating a nutritious diet? Could it be because of prolonged stress? Could it be because of the toxic effects of antipsychotic drugs? A question that you have to ask yourself. The more advanced the case, the greater the enlargement of the ventricles. The larger the ventricles, the poorer the response to antipsychotic drugs. Research has also shown that the lateral ventricles tend to be the most likely to be affected. And here is a case of a twin. One has schizophrenia and the other one does not. These are identical twins. This is the one that doesn't have schizophrenia. This is the one that does have schizophrenia. As you can see, the ventricles are much, much larger in the twin with schizophrenia. Discordant twin studies where one twin has schizophrenia and the other doesn't showed that in 75% of the cases, the hippocampus and the amygdala were smaller in the schizophrenic twin. The hippocampus, which is for memory, and the amygdala, which has to do with emotion, are smaller in the schizophrenic twin. Researchers speculate that the enlarged ventricles and smaller brain structures denotes atrophy of neural tissue. And that is what we're looking at. Looking deeper into the hippocampus, researchers have discovered that pyramidal cells of people suffering from schizophrenia are disorganized and suffer as compared to the normal individual. The degree of disorganization relates directly to the severity of the disorder. So it has to do with the pyramidal cells. And here is a picture right here. This is a normal individual. As you can see, they're organized. They're very, they're kind of like what you guys did to my wood in my entryway. Did you do that, or did your wife do that?
The wood.
Somebody straightened up the wood in my entryway.
Oh, that was probably Kat yesterday. She was there. She was there with she was there. I had to go to work.
Yeah. Okay.
So she said she was there with the pets, with my son. She said if it was okay to build a fire. I said, how long are you gonna stay? It was just for a while. So she stayed there, and I believe she's gonna clean up. Yeah. She did the clean up and fired up some wood.
Well, this is the way my house looks now. This is the way it looked before.
That's what. Okay, that's fine. But
yeah.
We did yesterday, the whole day yesterday. So she was there.
Okay. It's cold in my house. It's cold even on warm days. It's cold in that program, which is good for summertime, I guess, but it's not good for the winter time. Anyway, this is what a schizophrenic looks like. It's very disorganized, as you can see. And for people that don't suffer from schizophrenia, everything is quite ordered. Everything is in a very organized structure, but the disorganized causes schizophrenia. And if you think about it, if you've ever talked to somebody that, especially a disorganized schizophrenic, sometimes they'll start out talking about this is my drink, and then all of a sudden they're talking about dolphins and something.
Yeah.
Well, of course, if this is you, then you can talk about your drink. You can talk about the lemonade. You can talk about the fact that I made it this morning. You know, you can follow a pattern. But if you're a disorganized schizophrenic, you're talking about lemonade. All of a sudden, you know, you're talking about dolphins and the ocean and the fact, So as you can see, you know, you start following this path, and you're going okay, and then all of a sudden, you're off on a tangent someplace.
Yeah.
And that's the way their brains look, unfortunately.
I guess the kind of conversation I have with one of my siblings, they'll start off with something and they'll go off into real left field. And then I had to talk to him about why are you thinking this way? Well, then he goes off onto another one. Somewhere they'll have a common. There's actually like a little something that will make sense to him. They'll come back to me, you know, ask, oh yeah, okay, all right, I get it. And maybe it's probably,
sometimes they'll have a theme, like yellow or blue, you know, and so or red or stop or arrows or whatever. So there will be a common theme. So they're thinking about a yellow arrow or a yellow arrowhead, and then all of a sudden they talk about points, and then they talk about sticks, and they talk about trees, they talk about all kinds of strange stuff. But they're talking about yellow trees, and they're talking about yellow sticks, and they're talking about everything it all comes back together. And it makes sense to them, but of course you can't make the connection because your brain doesn't work that way. Your brain doesn't look for things that are yellow, things that are blue. It just doesn't do that. And of course, sometimes whatever the connection is, they're not telling you. So you have no idea what they're talking about. I just was reading a book about a serial killer, and they caught a kid that was schizophrenic, and everything that he did was yellow. Everything that he stole a baby because the baby was wrapped in a yellow blanket. It was in Russia, so they executed it. But the idea was that he only did yellow things, or he did things because he liked the color yellow, or because he was obsessed with the color yellow. Just really bizarre. So eventually they charged him with the serial killing, but of course his brain wasn't organized enough to do all these things that the serial killer did. And of course they couldn't convince anybody. So they just executed him. Ouch. But everything was yellow. It took somebody looking from the outside, looking in to see that everything that he did had to do with yellow. You know, he got on the yellow bus, and if he was walking along the street and he saw a yellow car, you know, that's all that was in his mind.
No, I know Charles Manson, he followed the Beatles lyrics.
Right.
Saying,
Helter Skelter.
yeah. And he followed through with the Sharon Tate's marriage. I think there was someone before that too, thinking about how the Beatles lyrics it's going to be like some kind of revelation or something. He had all these followers too.
You never know, there's hidden messages. Paul is dead, Paul is dead, Paul is dead.
I haven't really.
You haven't done that? You play the record backwards, it says Paul is dead.
All I have were Neil Diamond records.
Michonne and her colleagues speculate that this derangement in the hippocampal pyramidal cells occurs due to a maternal exposure to the influenza virus during the second trimester of pregnancy. Second trimester of pregnancy. When is the flu the most prevalent?
The flu?
The flu. In the fall. Okay. Into the winter. Okay. So it's the baby that's born in the spring that is the most likely to have been exposed to the flu virus.
Mm-hmm.
That's March, April, and May.
Yeah.
Okay. Just a thought.
Okay.
Is your son born in March, April, or May?
January.
He's home free.
Yeah.
My daughter was born in...
I was born in April.
Oh, really?
Yeah.
Okay.
Cat too.
Oh my God. Well, you know, schizophrenics marry each other.
Yeah.
Yeah, okay.
And my mom's in April. I think they were only 3.
Have you been diagnosed with schizophrenia?
I probably, but I keep going.
I think you're okay.
Thank you.
You're welcome. Looking at blood flow in the brain during the resting state, researchers have discovered that in the brain of a schizophrenia sufferer, the left hemisphere is more active than the right hemisphere in the frontal lobe. PET scans indicate that people suffering from schizophrenia have less metabolic activity in the frontal lobe than people that don't. And as we can see, this is a normal control, and this is somebody suffering from schizophrenia. As you can see, there's a lot less activity here than there is here. That looks about not done. Yeah, we got a lot more activity going on here. All over, except for right there. That's the hearing portion of your brain.
Yeah.
Right here.
No, a couple of years back, there was an individual in the town of Chinle. He had a motion spasm. His head would just keep going, and he had no control over it.
Oh, he would move it?
It would just go like this, and it was just
Probably
constant.
It's probably
walking,
a tick.
and when you would talk with him, it was he knew around his surroundings, but it just kept going. And
So his thought processes were okay?
yeah,
Okay. Yeah,
he would just keep going, and the locals were pretty much were aware of it, and they would keep an eye on him. Unfortunately, I guess he was walking back at night, and a vehicle that's having come through the area didn't see him.
You guys wear black clothes all the time.
He was wearing black clothes.
Even at night. Mike, I hate to drive through Chinle at night. I drove through Chinle last night about midnight, and I was thank God it's not 3 hours earlier, or I'd be, almost hitting every third teenager in Chinle. Because you all wear dark clothes. Drives me crazy. So I'm in Globe. I was in Globe last night. Of course, they've got lights, and it's not so bad. It's not so bad. And so I'm driving through Globe, and right in front of me, this couple walks across the street. And they were both dressed in black, and they looked like ninjas. And I'm thinking, oh my God, how stupid can you be? And then I looked at them, they were probably Apache. since they were so far south. But so they were still in Vermont. I don't know.
One of my friends, he grew up in Chile. High school era was kind of like the black era, where the trend was wearing black. It's probably still like that now, I don't know. But I remember he took off to college up in Flagstaff, in Furthermore. And he came back, he was wearing blue, yellow, and actually jeans and khakis. And we were still wearing black, and he was looking at him. It was like, explain something. It's like, where does all this rainbow came from? It's just different kind of community, you know. I think that's just more colors. What's the difference?
Watch the people come in from Psych and Law. Watch them come in. See how many of them look like they want to be ninjas when they grow up. Drives me crazy. I hate to drive around here now. You just never know.
Yeah.
You can't see anybody. Of course, the lights aren't any good either. Much of the proof that dopamine is a neurotransmitter, and Gallup, my God, these people step out in the street with a dollar bill trying to get you to stop and pick them up at night. Sometimes the only thing that I can see is the bottoms of their shoes.
Yeah. When I have my dad's truck, I'll pull over and they can jump in the back truck. They can't sit with me in the cab. I'll take them as far as where they want to go to. I turn off the window locks. Some of them will get out the window lock or down. Rarely they come way out this way. So that was when I had my dad's truck.
Only when you have your dad's truck. Much of the proof that dopamine is a neurotransmitter that is the cause of symptoms of schizophrenia comes from pharmacological studies. Tens of thousands of schizophrenia sufferers were able to leave psychiatric hospitals when chlorpromazine was discovered. Chlorpromazine and the phenothiazines block D2 type receptor sites. So it blocks dopamine, and so it works. Seems to work. Due to the pharmacological evidence, it seems that the effectiveness of the antipsychotic agents is directly related to the magnitude of the postsynaptic receptor blockade of dopamine sites. So that seems to fix schizophrenia in most of the cases. Parkinson's disease is caused by the degeneration of the nerve cells in the substantia nigra, which contain dopamine. When a patient is given too much L-Dopa to compensate for the loss of dopamine, they develop schizophrenic-type symptoms. Some schizophrenic patients will develop Parkinsonian-type symptoms if over-medicated with phenothiazines. So if you block the dopamine, one way or the other, if you give them too much L-Dopa or too much phenothiazine, then you can reverse the process. A schizophrenic will act like they've got Parkinson's disease. Somebody with Parkinson's disease will act like they have schizophrenia. However, some schizophrenic sufferers treated with dopamine inhibitors do not respond. Recently, a new generation of antipsychotics have been developed that do not affect just dopamine levels, and they work. These new types of drugs are called atypical. They're referred to as atypical. Clozapine is an atypical antipsychotic drug that not only blocks dopamine receptors, but serotonin receptors as well. Clozapine actually seems to increase dopamine reception in the frontal cortex, but we're not exactly sure. One theory about the development of schizophrenia is that select chemicals build up or are created in the brain that cause psychosis. These substances are referred to as psychotogens, literally brain monsters. One theory is that an addition of a methyl group to the brain chemistry can cause the conversion of normal compounds known as hallucinogenic agents. This is known as transmethylation hypothesis, the methyl crossing process. So it adds a methyl to your brain chemistry, a methyl group. The psychological model of schizophrenia emphasizes that there may be several factors in interacting with that cause schizophrenia. Each life phase of brain development provides potential triggers to the development of schizophrenia. People genetically predisposed with brain abnormalities may or may not experience the proper triggers in correct sequence to create the conditions of schizophrenia. So there's lots of triggers. One of them is a TBI. Another one is an infection in the brain, or like a flu infection, especially influenza. Hospitalization can cause the trigger to occur. Viral illnesses such as influenza and inoculations may be part of the trigger. The stress of urban life as compared to rural life shows that more people per capita have schizophrenia in urban settings compared to rural settings. Does that mean that rural settings keep you from getting schizophrenia? Probably not. It probably means, it probably shows that individuals who have schizophrenia gravitate toward urban areas. But it's probably the same as it is everywhere. 1.1 to 2% of the population have schizophrenia. Thus, schizophrenia may emerge when the combination of life stressors are added to the neurological triggers and the genetic brain abnormalities. So there has to be a trigger. And this is one of the reasons why normally if we see somebody coming down with schizophrenia, we can see it throughout their development. And then they'll develop schizophrenia in early adulthood. It'll trigger, something will trigger it and it'll happen. Sometimes though we have individuals that seem to be normal and then all of a sudden in their 30s they have schizophrenia. We've also seen individuals who seem to be normal going into the military.
I've seen that individuals throughout whole grade school and high school, then when he left for the military, he got sent back. And people from the military told me what happened, and I recognized him in one of the sessions at the hospital. And I greeted him, but he was different. It was ways that it was like talking to a child.
Right.
Very mischief.
Think of it this way: you've got this guy that seems to be a normal adult, All of a sudden, they go through something as traumatic as military training. Is not easy, and the reason is because they're trying to find these people. They don't want to give them a rifle and send them out into combat. Of course, they couldn't function. So what they do is in their brain they start going backwards in time. So to times when they could protect themselves, to times when they were protected by something, probably their parents taking care of them. So they find a time, and that's why they seem so childlike. They just can't handle it. I mean, and they're looking for a safer time, and this is one of them. We'll go into the whole mommy thing.
Yeah.
But a lot of people, as they're dying, they'll ask for their mother. But they usually don't ask for their mother as if, come here, mom, where are you? You know, as an adult, they ask for their mother as if they were a small child.
Yeah. He had a toy with him, so he was showing me his toy.
It's cool.
And I was looking at him, and I was like, I had to, go along with this by observing him. But today, I believe he got part of his life just phase over, because now he's a coal mine person.
Okay.
Pretty much he caught up with what he missed out. So
Sure.
he's good.
Okay. Now he's not.
He's giving away his stuff, so we're kind of like giving him, looking over him too at the same time. So.
Be careful. Autism is a lifelong developmental disorder. It's characterized by impaired social interaction, impaired language, a narrow range of interests and activities. They may perseverate, a word from persevere, head nodding, it might be a continual situation. Ritualized finger movement is very common. They have difficulty judging other people's thoughts and feelings because they won't look them in the face. is the reason why. Autism seems to have strong heritability. It occurs in 1 to 2 children per 1,000. It is far more common in males than in females. Study by Rodier at a rate of 1 to 4 to 1, males to females. A study by Rodier in 2000 demonstrated a common abnormal allele on the Hox gene of the 7th chromosome, reduced size of the corpus callosum of these select individuals, reduced size in select cerebellar regions as well. And reduced size of the corpus callosum. As you can see, this is a normal corpus callosum, and this is an abnormally small one. While periods of unhappiness affect everyone from time to time, prolonged chronic depression occurs most often in people over 40, and women 2 to 3 times more frequently than men. Why are women so depressed?
They deal with men.
They have to put up with men, exactly. Depression is not sadness, but is characterized by unhappy moods, loss of interest, energy and appetite, difficulty in concentration, restless agitation. Depression may not be triggered by an apparent stress. Without treatment, it may last for months. Depression may afflict 13 to 20% of the population at any one select time. Bipolar disorder is is diagnosed when someone who suffers from depression also displays episodes of excessively expansive moods, which include sustained overactivity, talkativeness, increased energy, strange grandiosity. And of course, I have 2 videos that you cannot see because I have the wrong projector. Depression may lead to suicide. Estimates are that 80% of the people who commit suicide are profoundly depressed. While suicide rates overall are decreasing in the Western Hemisphere, disturbing indications are that suicide in the younger population is increasing, and this is really quite distressing. One of the reasons seems to be social media. Not that social media is causing the problem, but social media is allowing people to separate themselves from other individuals. People are living without human interaction, with only technological interaction, and that seems to be causing more and more problems. There's also increased use of drugs among youth, maybe causing the suicides. Even marijuana, which people think is not harmful. Some individuals, of course, especially if they mix it with something else, sometimes they get the synergistic effect. We get a negative reaction from it. Looking at concordant studies, the incidence of depression is much higher among dizygotic as monozygotic twins. Concordant studies of monozygotic twins raised apart shows equally similar results. These studies point to a strong heritability of depression as well. And of course, if you can go into people's houses and sometimes you'll see mom's depressed, dad's depressed, all the kids don't act, none of the kids act very happy. Of course, if you were raised by 2 grouchy people like mom and dad, then probably you wouldn't be very happy either. Usually the individual, in these families you'll find like 1 or 2 kids that aren't depressed, and the rest of them are just really depressed.
Yay, mom.
Yeah, there we go. Is your mother?
Yeah, so we were happy.
That's good. Normally these people are looking for each other. It's just like alcoholics. Alcoholics marry other alcoholics. Schizophrenics marry other schizophrenics. OCD people marry other OCD people if they can stand each other. Depressed people are the same way. People with anxiety are the same way. People that are paranoid are the same way. It's just bizarre. People are looking for affirmation. They're looking for somebody that's just like them. And of course that's part of it. Okay. Heritability of depression. Depression is common in select medical conditions, especially those that involve the endocrine system and brain disorders. Cushing syndrome is caused by lesions on the pituitary gland that cause an excess amount of ACTH and hence cortisol. The first symptom is depression, followed by obesity, unusual growth and distribution of body hair, which is always kind of interesting. The body hair. Why don't we stop right here? We'll pick this up next time with Parkinson's disease.